I want to express gratitude to Survivor Journeys and to all of you for joining us this morning. And really to my patients who continue to teach me about this topic and many others related to cancer survivorship. So I want to begin with a quote by American journalist and author Jonathan Alter and he's also a cancer survivor. I came across this quote several years ago, and it's really stuck with me. The only constant in cancer is inconstancy. The only certainty is a future of uncertainty, a truism for all of modern life, but one made vivid by life-threatening illness. So what I'll be talking about today is really something that I think as humans we can all relate to, the idea of having some worry or concern of having poor health at some point in our lives or in the future. But certainly the experience of cancer is unique and makes all of these topics extremely salient. So that is to say, I don't want to over-pathologize or over-diagnose. Fear of recurrence is not a disorder or illness, per se. But nonetheless, it's a pressing issue that needs attention. So fear of cancer recurrence has been defined by a consensus panel as fear, worry, or concern about cancer returning or progressing. And this is an important definition because it's not just inclusive of patients who have completed treatments with curative intent, but also patients who are living with metastatic or slowly progressing tumors. And what we know, as Jay mentioned, of course, many cancer survivors will report having some level of worry or concern, but 1 to 2/3 of cancer survivors nationally, and then there's been work done internationally, report having clinically elevated levels of fear of cancer recurrence, thinking about it on a daily basis and having a lot of distress and impairment. Importantly, fear of recurrence does not seem to be associated with just one specific kind of cancer or the amount of time that's lapsed since completing treatments, or whether an individual has an anxiety disorder. We know that these fears can really affect all comers. In terms of some of the triggers for fear of cancer recurrence, there's lack of information is something that's very common for triggering these fears, and this happens when cancer survivors have questions that just aren't answered or they don't know who to turn to for help. There's ambiguity. There's ambiguity about symptoms, and so ambiguity occurs when you're not sure how to interpret a change in your body, and that ambiguity might generate fear. Is this a potential sign of recurrence? Ambiguity can also come up when you're receiving conflicting information. So maybe your oncologist is recommending one type of regimen and your sister who is diagnosed with a similar type of breast cancer is recommending something else. That conflicting information generates ambiguity, and in situations of ambiguity, that's where fear can come up. There's complexity. So we've had speakers this morning talking about the complexity of the landscape of cancer survivorship care more broadly. Feeling like your care is being lost in the shuffle of things can generate some uncertainty and fear about your care and future health. And then, of course, unpredictability about the future. I've never met anyone who can accurately predict the future with 100% certainty. And in that gray area, that's often grounds when our minds are going to the future, that's where fear will live. So very recently, there was published a meta-synthesis of qualitative 87 studies that had been done with cancer survivors, interviewing them to try to understand their experiences of cancer survivorship. And one of the key conclusions was that fear of cancer recurrence came out as a multidimensional experience. And as somebody who studies mind-body practices and kind of holistic health, this really stood out to me. And so I wanted to put together a conceptual diagram to represent what are some of the common factors that play into fear of cancer recurrence. So we know there's this physiological component. We know that physical symptoms that were discussed earlier, pain, fatigue, insomnia, when you're experiencing those, oftentimes then your mind will jump to, is this a possibility of potential recurrence? And then at the same time, we know that whenever we're experiencing fear, we're engaging the fight or flight response and increasing sympathetic arousal, which tightens the muscles in the body and will often exacerbate symptoms. So there can be this feedback loop that's really based on the physiological level. Of course, there are cognitive components to fear of cancer recurrence. As you're thinking about the future and thinking of how to understand and appraise different symptoms that might be going on in the body, there's some emerging research that shows that people who have less ability to tolerate uncertainty more broadly tend to experience more fear of recurrence, and also rumination, the thinking style of thinking about something negative over and over and over again more broadly, also seems to be associated with having more fear of cancer recurrence specifically. There are these behavioral consequences of fear of cancer recurrence. So I want to mention reassurance seeking, and this happens when you're experiencing fear about recurrence and maybe you want to get reassurance from your care providers. Hey, am I okay? And there's nothing wrong with doing that. And in fact, it's appropriate when monitoring symptoms or potential signs of recurrence. But taken to excess, that can be really impairing in your day-to-day life. One of our study participants referred to this as talking with Dr. Google. So she would go online and look up information, and there's, again, nothing necessarily wrong with that, but it can become consuming. And it can often generate more uncertainty when you're getting conflicting information and then you have more fear. Alternatively, there's this behavioral sort of reaction of avoidance. So just like if you have fear of flying, you avoid planes. If you have fear of cancer recurrence, for some cancer survivors, they don't want to think about cancer at all, and potentially that might mean that they're not adhering to follow-up screening and test and procedures, potentially placing them at greater risk for recurrence. And of course, there's this emotional and existential element to fear of cancer recurrence. Obviously, these fears are upsetting, and in extreme cases can lead to hopelessness, demoralization, and even suicidality. So I want to share with you a conceptual model that was recently accepted for publication in Journal of Oncology Practice, which should be circulated to oncologists across the country. And what isn't important is going through each of the studies that I've listed on here, or even this conceptual model, but I just want to point out to you that rather than thinking about these mind-body components on a theoretical level, what we're finding from survey responses from large samples of cancer survivors of different types of cancers, statistical support for these links. And if you're interested in any of these publications, feel free to contact me and I'd be happy to share those with you. So what can we do about fear of cancer recurrence? I have a few very brief recommendations, and I'll go into the last bullet point in a little bit more detail in the next few minutes. So the first bullet point is having routine screening for fear of cancer recurrence, not just within cancer centers, but also with primary care physicians as cancer survivors are living or receiving their care in the community settings. Care providers need to ask, hey, are you having worry or concern about recurrence? And depending on the response that you all give to your providers, the providers need to normalize this and validate it. Hey, you know what? This is a common concern, and I get that it would be really scary and upsetting. How are these fears impacting you? How are you living with it? How can I help? And one of the ways that providers can help is by providing referrals for evidence-based mind-body interventions that research shows can be effective, efficacious at helping cancer survivors manage these fears. So we know that cancer survivors in the United States who experience fear of recurrence tend to seek out mind-body practices more than cancer survivors who don't experience these fears. What we see overall in the United States, about 3/4 of cancer survivors report having used some type of mind-body, either relaxation or therapy practice in the last year. Most commonly, relaxation training or sedentary meditation. So these are things like mindfulness meditation or guided imagery, and to a somewhat lesser extent, things like meditative movement or yoga and Tai Chi. One of the chief reasons why cancer survivors are using mind-body practices are really to mitigate the risk of recurrence and manage stress. And among those who are using mind-body practices, they're reporting benefits of stress in terms of stress and coping. So we know that mind-body practices anecdotally, can be helpful, but my question as a researcher was, well, are there certain mind-body practices that are more helpful? What types of treatment programs seem to be most helpful? So last year, my colleagues and I published a systematic review and meta-analysis of randomized controlled trials that had tested mind-body interventions for addressing fear of cancer recurrence, and here's a little bit of what we found. So as of, I guess it was early 2018, there had been 19 randomized controlled trials published, and what was really notable was half of them had been published just in the last few years. So this is speaking to the developing recognition that, hey, this is a major issue that we need to address through really patient-centered clinical research. Of the types of practices that have been studied for fear of cancer recurrence, most commonly were cognitive behavioral skills and meditation, things like mindfulness meditation or other types of seated or movement meditations, like I mentioned, yoga and Tai Chi, and to a somewhat lesser extent, relaxation and skills related to positive psychology or finding gratitude, kindness, and self-compassion. So what did we find about the treatment components that seem to work best? Collectively, these interventions yielded, statistically speaking, small to medium-sized reductions in fear of cancer recurrence, which is promising. So this means that better than in comparison to control conditions, these interventions seem to be helpful on a statistical level, but small to medium-sized reductions, I don't know about you, but to me, I would hope for large reductions in fear of recurrence. So this suggests to me that there is some room for improvement. When we did some sensitivity and moderation analyses, we looked and saw that interventions that combined more than one kind of skill and those that were delivered in groups tend to be the most helpful in terms of reducing fear of recurrence. Just because of the number of studies that have been done on cognitive behavioral therapy and meditation, we have the greatest confidence that those types of practices are really helpful for managing fears. But there were some promising effects with skills like relaxation training and positive psychology. So my question was, well, could we develop a program that includes these components? Or better yet, is there an existing program that might include these components, but maybe isn't focused on fear of recurrence? And maybe we can adapt that program to specifically talk about fear of recurrence and other aspects related to cancer survivorship. So my colleagues at the Benson Henry Institute for Mind-Body Medicine at Massachusetts General Hospital, and I see some head nods, so maybe some of you are familiar with this program, had developed a comprehensive program that actually includes most of the components that we recognize through our systematic review. Importantly, this type of program has a treatment manual so that you know if you're receiving this program, it's being delivered consistently in the same way. It's delivered in groups, and for other medical populations, it's been shown to be very helpful in reducing stress. It just hadn't been tested yet among cancer survivors. So it took about a year, and we went through this whole process of working with groups of cancer survivors and local cancer survivorship experts, and we adapted the content, and then we tried to test it in a pilot study. So for the next few minutes, I'm going to share with you some of our preliminary findings from this pilot study, and then leave you with a few key points. So for this pilot study, we had a few very simple questions. If we were able to identify eligible for this trial cancer survivors around the Boston area, would they be interested in this kind of program? Would they sign up for it? Would they attend our sessions and complete surveys that ask about some uncomfortable things, that ask about what are your uncertainties and fears, and how do they impact you behaviorally, emotionally, existentially, et cetera? And most importantly, would they find the program to be helpful? We recruited and enrolled 23 cancer survivors from Beth Israel Deaconess Medical Center, a hospital in Boston. On average, participants were about 61 years old, about a year out from completing their treatments. Most of the participants for this program were non-Hispanic white women, but you'll see a variety of cancer types represented in this program. And this is really important because, again, we know that cancer survivors, or that fear of recurrence affects a wide variety of cancer survivors. And then finally, most of the participants had completed surgery, chemotherapy, and radiation. So of these participants, we asked them to rate how much did you enjoy the sessions, how much were these sessions convenient, were they helpful, what are the odds that you'll use these skills related to cognitive behavioral practices and meditation and relaxation training, what's your overall satisfaction? And overall, we're seeing fairly high rates of acceptability in that domain. Most of the cancer survivors who would be screened for the program and we saw were potentially eligible did end up enrolling. Most participants attended the majority of the 8 sessions, suggesting that it was feasible for them to come. And they did, in fact, complete surveys as well as the exit interviews. And what I'd like to share with you are some of our preliminary findings from those surveys and exit interviews. So we asked in these surveys questions related to the severity of fear of recurrence, triggers of fear of recurrence, how much impairment you have on a day-to-day basis related to fear of recurrence, and your general intolerance of uncertainty, right? These are key features of fear of recurrence, as I mentioned earlier. And again, what we saw was interventions to date collectively yielded those small to medium-sized effects. And we were encouraged because this program that we're developing did seem to yield large-sized reductions in fear of cancer recurrence, suggesting that this combination approach really does seem to be helpful. We also asked questions related to stress and distress, and again, we're seeing before and after the program, large-sized reductions in the amount of distress cancer survivors were reporting from fear of recurrence, as well as their overall stress. And then finally, we asked a little bit about the positive. So your ability to cope specifically with fears of recurrence, your confidence in your ability to use relaxation skills, notice signs of tension in the body, your overall coping, self-efficacy, as well as resiliency. And again, here we're seeing, for the most part, large-sized improvements in these domains. So we also conducted exit interviews, and to me, these are really exciting, again, preliminary data that I wanted to share with you. But we went through a process of analyzing these exit interviews to try to extract what are the common themes that are coming out in terms of what changes did you notice in fear of recurrence as a result of participating in this Mindbody program. I won't go through all of the bullet points up here, but it was interesting that these overall themes tended to map onto our conceptual model. And what I'd like to do, I think we have a few minutes, is to share a few quotes directly from the participants so you can see a little bit about their experience. So one participant said, "We may not even realize what we're doing, and so pointing out these negative thoughts or pointing out how these can affect your body and trying to do meditation and imagery, and all of those things is a tool. And yes, I think it's a great aid to somebody who has had cancer." So a big emphasis of our program is teaching skills, not necessarily just being in a group and processing, although that's important, but each session participants are learning probably like 3 to 5 new skills, and in between sessions, they're practicing them. So to me, this quote sort of speaks to how important it is to have very concrete skills. Another participant said the self-blame. I don't blame myself as much. I learn that each week. You know what? Don't blame yourself. And by being in the group with other people and hearing about different types of cancer, it just made me feel like, you know what? No one did anything for this disease. It just happened. Another participant, for them, they took away some of the positive psychology components of validating these, yes, okay, I have these fears, and you know what would it look like for me to have a little bit more humor in my life as I think about the uncertainty and fear? Is there room for this? I can feel afraid and use humor as an adaptive coping. So she said, you know what, yes, I'm fearful, but I know I have a good medical team behind me, and that's what they're there for, to help make it through this. So that's definitely the meditation, absolutely. And being optimistic about things, and also finding humor in things. You don't have to take things so seriously. Enjoy life and have humor in it. And also talk about gratitude. That helped me too. Like, you know what, yes, I got a cancer diagnosis. I was very lucky that mine was curable. So I just have a few more quotes I'd like to share with you about some other takeaways from, again, this comprehensive mind-body approach. So another participant said one big thing that I really took away from the group was the fear of recurrence. If you're going to have the fear, set aside time for it. Don't let it consume your day, because it was really consuming my day. So I think what this participant was talking about was specifically this skill called worry time that we teach in our program, which is basically saying, you know what? Go ahead and worry. Go ahead and worry about recurrence, but do it for 10 minutes a day, and do it at a time and place of your choosing, so that it's not interfering with your day-to-day life. So it's really validating. It's not saying I'm a bad person or I'm neurotic for having these fears. It's allowing yourself the space to think about this, because, okay, it's understandable to have these fears, but maybe don't do it when you're driving. Or maybe don't do it, when you're at the dinner table with your family, so to speak. And so penciling in this worry time can be an effective tool. Another participant said it gave me tools and techniques to use when there's uncertainty there. There's always this uncertainty of what will happen. And how do I deal with that? There's a bunch of skills taught to help you. If it's something you have no control about, then you can do some meditation, and that helps. So we talk in the program about how to figure out what's within your control and what isn't, what types of skills work well when your worries and concerns are within your control, like maybe appropriately seeking information and learning how to get connected with resources. Some questions just can't be answered, really. I mean, is cancer going to recur 100%? I don't know that we can answer that fully, right? And so maybe problem solving isn't as helpful as acceptance-based strategies, being grounded in the present moment. And then finally, this is a person who had talked about Dr. Google. And she said, I was caught up in statistics, and this program helped me to get out of the statistical trap of triple-negative breast cancer. Why am I really overwhelmed with the statistical business of some 40% of all breast cancer patients have recurrence? And then you jump to stage 4 and don't even go to gradation. So my head was just stuck in too much of the sort of research information. So she's talking about a little of the reassurance seeking and maybe some rumination. So very briefly, I just want to mention that in the next month or so, we'll be looking at follow-up surveys to see if some of these benefits that the participants were talking about are sustained over time. And then we also recently learned that we received a 5-year grant from the NIH to further develop this program and test it. So if anybody's interested in learning a little bit more about that, recruitment should begin this summer from a few hospitals around the Boston area. And that program will also really focus a little bit more on how cancer survivors are engaging with their healthcare system as a consequence of their fear. So in summary, I hope you all can know that fear of recurrence is common. If you're experiencing it, you're certainly not the only one. In fact, it's oftentimes par for the course throughout the cancer journey that you'll experience these fears. They can be distressing and in some cases lead to unhelpful behaviors. But a variety of mind-body techniques can help, especially cognitive behavioral therapy and mindfulness meditation. And I hope you all also will take away that novel treatments are being developed so that we can efficiently teach cancer survivors these skills, like delivering them in groups and embedding them within academic or medical institutions. So with that, I'll wrap up. I want to thank you all for listening to me this morning, and to my team of mentors, research assistants, funding, and the institutions where I work. Okay. Yes.
Questions and comments. Since you're from the Boston area, I'm also from Boston. Will it be a better job to have a broader representation because you had no Latinas and the number of African American was very given the population in Boston?
Absolutely. We see, in general, an overrepresentation of non-Hispanic white women more broadly in most research, but certainly related to cancer survivorship. And you're right, that those demographics aren't representative of cancer survivors more broadly, as well as those within the Boston area. So that's a big part of the next research study, is to get better at honestly recruiting more representative groups. So I appreciate you bringing that up.
Thank you.
That is.
My comment is, I'm from Cancer Connection, we're headquartered in Northampton, Massachusetts, and a lot of what you're talking is actually central to what our program is. So this is great information. We do very, very well. People love coming to us because we deal with the FCT.
Yep, the fear of recurrence, FCR.
Some of the things that you mentioned, we even do too.
Oh, terrific. Wonderful.
So thank you. Our services are free of charge.
Oh, excellent. All right. Thank you.